Good morning. Myself Dr. Nidhi Shukla, Assistant Professor from Paramedical Department, Rama University, Kanpur. So my today lecture is Sacroiliac Joint Syndrome. It is also known as the SI joint syndrome. That is related to the both of things. First one is the SI joint dysfunction, and the second one is sacroiliitis. So one is the SI joint dysfunction. It is also known as the low back ache, and number of patient that is complain that what is the low back ache and what is the kind of symptoms, what is the etiology behind it. So there is the dysfunctioning in the SI joint that is create in the low back ache, and also it is a mechanical low back pain and low back dysfunctioning. But the second terminology that I used in this topic, that is the sacroiliitis, that is the itis, it means inflammation. So if any kind of inflammatory condition is occurred in the sacroiliac joint, so there is symptoms is a different kind, that is pain in the SI joint, and there is the radiating pain will be created in the SI joint. Dysfunctioning will also occur in the SI joint. So that is a different kind of condition, sacroiliitis, and the sacroiliac dysfunctioning, there is the cause is different. So in this, the sacroiliac joint dysfunction syndrome, it means a number of condition will be occurred in the one of condition. So there is the two main condition will be occurred. First one is the SI joint dysfunctioning and the sacroiliitis. It is the inflammatory condition. There is the dysfunctioning will be occurred in the sacroiliac joint, that is dropping of the pelvic, and one of the malpositioning and malfunctioning will be occurred in the sacroiliac joint. So if the malfunctioning will be occurred in the sacroiliac joint, so there is the dysfunctioning will be occurred. So the patient complain in the sacroiliac joint pain, when pain created in the sitting position, when they are doing any kind of conditions, so the pain will be occurred in the sacroiliac joint. So now I am going to the introduction. Sacroiliac joint syndrome, there is the two condition will be occurred in the syndrome, dysfunctioning and the inflammatory condition. So dysfunctioning will be occurred number of those athletes that is creating recreational athlete, and the joggers, there is the sprinters, jumping activity, those are doing the jumping activity like a basketball players, like a footballer player. So in those athletes, the sacroiliac joint dysfunction is a common problem. But the that is the itis. Itis is also represent the dysfunctioning. Itis is also represented when the impaction will be occurred in the sacroiliac joint. So the pain will be occurred, inflammatory condition is present, those athletes and those population, those number of patients. So it is much more common, will be occurred, generate with the dysfunctioning and the itis. Now I am going to some of the clinical anatomy. So the sacroiliac joint, so sacrum and one is the iliac. The lower back bone, after there is the joint, the sacrum and iliac, there is the joint together and forming the SI joint. This joint is 1 degree of motion or not motion will be occurred, not movement will be occurred, number of muscles that reacting, that move, then the SI joint is moved. One is the piriformis and the gluteus muscle, both are moved when the joint is moved. Otherwise the sacroiliac joint, when we are moving, so the number of forces will be occurred and required, so the SI joint will be moved. So this is the non-movable joint, and the 1 degree motion will be occurred in the sacroiliac joint. So if the inflammation occur in the cartilage, there is the presenting in the cartilage, when there is the joint is formed, there is the some of the cartilage and the hyaline cartilage will be presented, articular cartilage is presented. There is the if the impaction will be occurred, if the tearing will be occurred in this at the site of the joint, so there is the inflammatory condition is present and requires and generate the number of symptoms like a pain, like a dysfunctioning, like radiating pain, stabbing pain. That's the clinical features will be occurred in the SI joint dysfunctioning and SI joint syndrome. Now I am jumping to the etiology. The etiology of the sacroiliac joint, there is the 88% of the population that is occur the sacroiliac joint syndrome. There is the trauma that is depending upon the micro trauma and the macro trauma. So 88% dysfunctioning or the syndrome in the SI joint will be presented by the trauma. Then 20% population that is giving symptoms of the SI joint dysfunctioning, that is the after pregnancy, at the time of pregnancy or after the pregnancy. So there is a loading at the site of the SI joint. So there is the lordotic position will be occurred. So the force will be coming at the site of the sacroiliac joint. So the pain is creating at the site of the sacroiliac joint. Dysfunctioning is also presented, but the inflammatory sign is more presented because the dysfunctioning. Then the 2% or 3% that is we are showing the idiopathic disorder. Idiopathic disorder is like a low back injury, low back pain, or if the athletes will be occurred in the SI joint dysfunctioning or syndrome. So there is the number of condition is required. Idiopathic is not known in the etiology. So it is a 2 or 3%. And after that we don't know the etiology, that is a sacroiliac joint dysfunctioning will be occurred, is occurred in the low back ache, it is occurred in the PIVD, also it occurs in the core muscle instability. So there is the pain will be occurred in the at the site of the SI joint. So we can say that is the syndrome or that is the dysfunctioning. Okay. Now the next point is the clinical feature. So number of clinical features will be occurred in the dysfunctioning. First one is the pain that is at the site or radiating in the both leg or the one leg. It is unilateral or bilateral also. There is the stabbing or shooting pain, difficulty in walking, difficulty in running, difficulty in creating any kind of movement. And when the patient is in the sitting position, there is the pain is occurred at the site of the SI joint. So the patient can say that is the low back ache also. So there is a pain, dysfunctioning will be occurred, redness, inflammatory sign, dysfunctioning will be occurred, and after the last stage there is a dropping of the pelvic will also seen in the patient because of the dysfunctioning is the shifting of the sacroiliac joint, the upside and the lower side. So there is the number of clinical features is seen in the SI joint dysfunctioning. After that we are jumping the diagnosis of the SI joint dysfunctioning. There is the diagnosis, the radiographic evaluation. Radiographic evaluation. Under the radiographic evaluation, we can see the X-ray, MRI also. Next is the special test of the SI joint dysfunctioning. That is the Faber-Patrick test. That is known as the flexion, abduction and the external rotation. Forcefully external rotation is when the patient is in supine position, the leg is in the extension, then the flex of the figure of 4 creating, then the force is occurred, force is generated in the site of the knee, downward force. So the pain is occurred in the sacroiliac joint. When we are seeing the patient gait, so the Tenderberg sign, Tenderberg gait is seen. Gait is seen. The range of motion is also decreased when we are seeing the leg range of motion. So that is decreased because of the pain, not because of the dysfunction, because of the pain. So the number of diagnoses is seen. Special test, number of special tests we are doing, but the Faber-Patrick test is the that is the one of the some special tests that will we are doing in the SI joint dysfunctioning. Okay, now the treatment of the SI joint dysfunction. So treatment is depending upon the degree of injury or degree of dysfunction. So when we are saying the PT management of the SI joint dysfunctioning, the first one is targeting of the core muscle. So we are targeting the core muscle stability or instability. If the core muscle is stable or the pain is occurred in the core muscle, so we are stretching, doing the stretching and strengthening of the core muscle. Okay, now the next treatment or the next PT management is we are doing the mobilization of the SI joint. Mobilization of the SI joint is the lateral side, is the side of the SI joint in the supine line, or we are doing also in the prone line and the side line position. So mobilization is occurred in the grades wise, grade 1, grade 2, or the thrust will be applied. When the thrust will be applied, so that is the manipulation of the SI joint in the degree of 3. And the last degree we are doing the manipulation of the SI joint. Number of range of motion exercises we are doing, that is the passive and active ROM exercises, and also we are doing the gait training or also the balance training we are doing in the SI joint syndrome. So the summary or the briefing of the SI joint dysfunctioning or the syndrome, SI joint syndrome is divided into two types, dividing the introductory process of the two types, that is the SI joint dysfunctioning and the itis, sacroiliitis. Dysfunctioning is also known as the mechanical low back pain or mechanical low back injury. Or dysfunctioning will be occurred if the shifting of the SI joint in the upper side and the lower side. Itis is the inflammatory process, inflammation occur in the sacroiliac joint. So the pain will be occurred at the site of the SI joint. Okay. So there is the syndrome. So that's why it is a different kind of, that is dysfunctioning and the sacroiliitis. Okay. Now the clinical features of the SI joint, that is the pain is occurred in the SI joint, stabbing, shooting, radiating pain is occurred in the SI joint, and number of clinical feature, that is the inflammatory process is occurred in the SI joint, and number of condition is occurred. Diagnosis, radiographic evaluation, and the special test, that is the Faber-Patrick test, Tenderberg gait that we are seeing in the SI joint dysfunctioning. Treatment is depending upon the degree of SI joint dysfunctioning. First one is the, we are saying that is the PT management, is the core muscle strengthening by the ball, physio ball, and mobilization, manipulation depending upon the grades of injury, and the last one is the range of motion exercises, gait training, and the balance training is required for the SI joint dysfunction. So that is all my topic. Thank you so much.